So I want to bring up a person that many of you know. Sue Acquisto is the chair of the Nursing Advisory Board, and she's going to update us on much of the impressive work that they continue to do.
Well, thank you very much. It's my pleasure to be here as well, to be able to share with you our work and a great appreciation to the physicians that many of you heard from that helped mentor our Nursing Advisory Board with guiding recommendations so that we can advance the scientific knowledge of our nursing staff. But more importantly, you're going to hear what we do with the patient's feedback. Because we are your first line, we are frontline caregivers. As we listen to you and listen to your needs, we are always searching for better ways to improve our methods to care for you as patients. So thank you, Nabil, thank you, Katie, Stacy, for the privilege of presenting our work to you. First of all, hold on, got to figure out the, is the green one with the, okay, oh yes, thank you. Okay. So you'll see up there, it's a true collaboration. And as I mentioned earlier, with the help of our physicians, they helped recommend nursing experts from around the country and actually around the world. In the UK, you see there that we have a registered dietitian from Birmingham, and we have from the Mayo Clinic and Memorial Sloan Kettering. Lorraine Drapik is my co-chair from Mass General, and Renuka Iyer, our physician advisor. And so we really wanted to have an interdisciplinary or an interprofessional group. We have a physician assistant, we have nurse practitioners, we have patient advocate, Kate Telek, and we wanted to be able to hear from her on a continuous basis as part of our group as to what our patients are saying that they need as well. We do welcome new members. So patients, if you have a particular nurse that you have gotten to know very well that's very interested in advancing scientific knowledge and working with our group, we certainly take those recommendations as well as from the physicians, any of the interdisciplinary nursing staff from their institutions. Truly, our mission is to advance the scientific knowledge of the symptom experience for our nursing staff to be able to care competently and confidently for our patients and to improve the quality of life for our patients with cholangiocarcinoma. We are an international, multi-institutional collaborative, as well as a multidisciplinary collaborative. We do seek to have other disciplines on the group as well. If we would, we are trying to search for like a social worker or a psychosocial expert as well, so that we could become an interdisciplinary practice committee. I'm going to take you on our journey from whence we started in 2013 as this group. For many of the new patients that are in this room, and some of our new physicians and experts and scientists that have joined us with this particular conference. Our first step really was to assess the current state of knowledge, what was in the literature. We did an extensive literature search with multiple databases. And with that, to identify what was in the literature around nursing care of patients with cholangiocarcinoma. And we then identified with patient feedback, as well as what the literature had said, it stated, was what was the most common signs and symptoms that these patients face. And then we developed what we call clinical nursing practice guidelines for evidence-based practice and consensus. And how we did that, our model, is that, of course, in developing the guidelines, we utilized our nursing process, of course, the assessment interventions, our references, and then did an evidence-based rating on our references to make sure that the references that we were utilizing for these practice guidelines were indeed highly reliable and highly valid. So in that, really our formula was, with the literature search, what we couldn't find in the literature, we supplemented with institutional practice. From the experts that we had on our board, we had what do they do in their institution, because we couldn't find anything in the literature to support. We then had a consensus, and then, of course, submitted this to our medical advisory board of the Cholangiocarcinoma Foundation for their approval. You'll see here's the evidence-based model. This is the Johns Hopkins evidence-based model. We felt this was important as our level of rating for the evidence, as I described a little bit earlier. And you'll see there from level 1, is it a randomized controlled trial, all the way up to level 5, is this a consensus of renowned experts in the world or in the U.S. to support this literature. It is interesting to note that we presented this to the Oncology Nursing Society, and they have now adopted this rating scale for all of their publications in the rating of publications and literature. So this is a continuation of that evidence-based scale, being the high and low levels of ratings, so that we rated each and every article. We had over 100 articles that we referenced for our initial set of clinical nurse practice guidelines. Those clinical nurse practice guidelines, this again was based on our patient input, as well as what we found in the literature as a need. We developed with care of the patient with the external biliary drains and internal bile duct stents, care of the patient with intractable nausea and vomiting, the fatigue that they experience, ineffective coping and mindfulness, the weekly gemcitabine and cisplatin chemotherapy regime, the photon radiation, those receiving protons on a clinical trial, and care of the patient preparing for a liver transplantation. So we discovered this was our initial and most basic important aspects of care to be able to present to the nursing community on guidelines. Again, we recruited our registered dietitian from the UK. So then after we developed those guidelines, we went on a mission to get it publicized to as many organizations and as many presentations as we possibly could. We then presented this at ASCO at the Palliative Care in Boston in September 2015. Here at this conference in February of 2016, ASTRO, which is the Radiation Oncology Society, the European Oncology Nursing Society at their annual conference in Dublin, the International Transplant Nursing Society in Florida of last year. Then last year, we participated as a nursing collaborator in the first Asia-Pacific Cholangiocarcinoma Conference, in which we presented 3 presentations. One was on the clinical nursing practice guidelines that we shared with the Thai nurses, in addition to interdisciplinary communication, crucial conversations around biliary stents and drains. Dr. Iyer, our medical advisor, chaired and presented the work that we did together at GI ASCO 2017 on the RAND and UCLA Delphi panel consensus on the management of cholangiocarcinoma patients with biliary stents. And then we submitted an article, the NAB, on the Clinical Journal of Oncology Nursing, a spotlight on cholangiocarcinoma, and it's been accepted for publication for August 2018 issue, with what I might add, a high reliability and a high validity rating by the Johns Hopkins scale that they decided to use as a result of our work. So we were really thrilled about that. This is our next big project that we started on in 2017, and Karen Driscoll is here in the room, and she's one of our nursing advisory board members, and just have to give a great shout out to her because she took your input, patients, from the discussion board, from your Facebook focus groups, from your phone calls, and she noted the data that there was a decreased quality of life because of the confusion around how to care for the biliary drains. And you had to go to some of your Facebook groups and asking each other, how do I care for this drain? How do I empty the bag? Can I go swimming? What kinds of things can I do with this bag? Because there was much confusion around how to care for that. So what Karen did is she contacted 10 university institutions and obtained their publicly published discharge instructions for biliary drains and stents. And so what we found was there was a widespread, inconsistent instruction for these patients to, very little to, it just was a very inconsistent information as to address some of these critical needs these patients had. So we developed a SurveyMonkey questionnaire of teaching materials that's directed towards the nursing staff. Now, the nursing staff that's going to answer this questionnaire are the nursing staff of interventional radiology and endoscopy, because most oftentimes those are the nurses in those departments that's going to give the patients these instructions. The questions that we have around the biliary drains involve who administers the discharge teaching, what kinds of instructions are given for bathing, dressing changes, the drain site care, the stopcock replacement, emptying the external drainage bag, flushing, symptoms to report, tube exchange, and troubleshooting. All of these major headings, these major topics were areas of confusion for the patients, and as well as the inconsistent discharge instructions that we found with the institutional discharge teaching. So Renuka has helped us with getting this through an IRB approval. She has submitted this as a continuous quality improvement study through Roswell Comprehensive Cancer Center for us to be able to distribute this questionnaire. Renuka also sits on the NCCN hepatobiliary panel, in which they have also expressed interest in this study. So the questionnaire, as I said, will be distributed by the NCCN panel to the nursing staff of the interventional radiology and endoscopy departments of the NCCN centers. We wanted to start off with the NCCN centers. Certainly, if there are other centers around the world globally, we would extend that. We do see this as an ongoing study, but we wanted to start at least as a base, the NCCN centers. The questionnaire responses will be analyzed by our Nursing Advisory Board. We will be co-investigators in this study, this prospective study. We have submitted an abstract to the Oncology Nursing Society around this study, and we were accepted, and we'll be presenting this abstract in May of this year. So our goal in all of this is, of course, our improved patient care and a greater understanding for our patients on care of the biliary drains. Other clinical nursing practice guidelines that we plan on developing, of course, the management of pruritus, which is that uncontrollable itching that some of our patients experience with treatment in this disease. Nutrition management, which you had heard some of the nutrition. We plan to put that in some guidelines to be published. Management of biliary emergencies. We wanted to follow suit to the physician Delphi panel findings. Management of adverse events of immunotherapy, and the survivorship needs assessment. And really, what are your needs? And we welcome your feedback from all of our patients. As in a survivorship, what are your fears, or what are your most needs that we can address to provide you with information? Certainly, more collaborations. I'd like to recruit additional international advisory members as well as the U.S. We will be presenting at the second Asia Pacific Cholangiocarcinoma Conference in Thailand. We're also going to Chiang Mai and Shanghai, China. We will be presenting on care of biliary emergencies, radiation, chemotherapy, and palliative care with pain and stress management. And so we will be collaborating with our Thai nursing colleagues once again. And we also are we're going to research other opportunities for additional global nurse collaborations, whether it's delegations or combined papers, presentations to share standards of care and guidelines globally. So thank you. Thank you for your attention.